Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
Destigmatization is super important. People haven't historically felt comfortable talking about these feelings like they might about a medical condition.
Suicide is one of the leading causes of death in the United States. And while talking about it can be really difficult, not talking about it can be even worse.
There's this myth out there that you shouldn't ask about suicide because you're going to plant the idea in the person's head. That is absolutely not true. That's been proven not to be true.
Dr. Mike Franz is the Executive Medical Director of Behavioral Health for Regence.
So if you're concerned about someone, you should ask and ask them directly, are they considering suicide, and then help connect that person to appropriate care.
About 49,500 people took their own lives last year in the U.S., the highest number ever, according to the CDC.
Suicide is often a permanent solution for a temporary problem, especially for our young people who may be facing a very significant crisis. And I don't want to minimize that, but whatever is going on in that moment is likely going to change, improve, get better.
So what should you do if someone in your life is struggling? Well, first, let's talk about some of the warning signs.
If someone's sleep is changing dramatically, or they're not eating as much, if they're expressing feelings of hopelessness or helplessness.
And there are things that we can all do to prevent suicide, actions that we can take to promote healing, help, and hope. Here are some steps from the 988 Suicide and Crisis Lifeline. First, ask and be there. People are more likely to feel less depressed, less suicidal, and less overwhelmed, and more hopeful after speaking to someone who listens without judgment. Next, keep them safe. Studies show that when lethal means are made less available or less deadly, suicide rates by that method decline, and frequently, suicide rates overall decline.
If we can remove the lethal means, if that firearm can be separated such that it's not accessible for even 10 minutes, you can decrease suicide rates very markedly.
After someone gets immediate care, help them stay connected and follow up. Research shows that helping someone at risk create a network of resources and support can help them take positive action and reduce feelings of hopelessness.
Depression and suicidal feelings are treatable. People do get better.
And remember, help is available 24/7. It can be as simple as calling or texting the National Suicide and Crisis Line 988. Find more resources at kgw.com/healthiertogether.